Hi, my name is Dr. Greg Doerr, and I want to just give you an introduction to my taping class called Functional Taping for Musculoskeletal Injuries, or FTMI. FTMI is a class that I developed largely actually invitation from a chiropractic school who had asked me to come up and do it as part of the rehab diplomate. Now, the interesting thing I was thinking to myself is I had taken a lot of the different taping certifications by that point, or at least the ones that were available. And through the process, I kept saying, well, I knew how to tape everything, but the thing that always frustrated me is nobody ever told me why I was taping. They just said, oh yeah, back of the shoulder hurts, tape it. Oh, front of the shoulder hurts, tape it. Bicep hurts, tape it. That really wasn't good enough to me because I was doing that in practice and I was noticing sometimes it worked and sometimes it didn't work. So I largely developed a class based on algorithms that are going to tell me when taping is appropriate and which taping technique to use. So the FTMI concepts are 5 algorithms. The first one is don't tape, meaning you come up with a provocative activity during evaluation, whatever it is that you might be doing. A fascial pull, a soft tissue treatment does not change it at all. In other words, the bicep hurt when I curled. I did a soft tissue treatment over it, and when I did the curl again, it didn't get any better. I pulled on the skin and I did the curl again, it didn't get any better. Most likely, that bicep is not going to respond to putting tape directly over it because you've already stimulated the same receptors that would be associated with that. The second application or concept is actually simple neurosensory taping. In other words, taping directly over a muscle group. I did the bicep curl, it hurts. I do my soft tissue treatment, it feels better, but when I do fascial pulls, it doesn't make a difference, okay? So again, the soft tissue treatment makes it better, but there's no difference with the fascial pull. We're going to do a straight neurosensory taping right over that body part. The third application is going to be associated with fascial pulls. So we have a manual muscle test or an activity that made somebody hurt, okay? I'm using biceps because it's an easy one. It could be a squat. So we do that bicep curl, it hurts. We do a fascial pull and the hurt goes away. In fact, it gets much, much stronger and the pain is significantly reduced. In that case, we're going to use tab taping, Tim Brown's SPRT taping, and we're going to use that fascial pull directly as we did it in order to correct the problem. Our next one is going to be associated with fascial sling taping. That's going to be concept 4. Concept 4 is somebody does, and we use this example frequently, they do an overhead squat and you see them dip into one side. Well, frequently what people would say is, oh, that oblique line in the back is weak, so we're just going to tape the oblique line. Well, how do you know that's actually going to benefit somebody? You don't. How do you know that normalizing the anterior oblique line isn't going to be what makes somebody feel better? So from that perspective, what do? We start with a soft tissue treatment. We start treating that fascial sling in sections to find out if the stimulation of any one of those nerve receptors actually all of a sudden normalizes the tone. If it doesn't, it's most likely a rehab-oriented event that we have to do. We have to create the road, not necessarily pave it with a taping technique or a soft tissue treatment. So I do my squat, I go in like that. I treat that back line and all of a sudden it gets perfect. I'm going to tape for that fascial line from hip to shoulder. If it doesn't get better, I'm going to test that anterior line. I'm going to start treating that anterior line. If all of a sudden it gets better after treating the anterior line, I'm going to do the taping from the front. If it gets better after just taping or doing a soft tissue section from shoulder to sternum, all I'm going to tape is that section of the fascial line because that's all that needs to be stimulated in order to correct the squat. That's our 4th algorithm associated with functional taping for musculoskeletal injuries. Our 5th one is basically getting people into the mirror image of what's creating their pain. So in other words, if somebody has an ankle sprain by going into plantar flexion and inversion, well, what we want to do is tape into stability of dorsiflexion and eversion. So these are more structural applications where we're actually blocking injurious motions. That can be done both with strapping tape as well as with high stretch kinesiology tape. Somebody has an upper cross pattern that's creating radiculopathy into their arm, but if they come back and down, all of a sudden their symptoms start centralizing. We're going to use our concept 5 of correcting for postural distortions or moving the person into the opposite end of instability. So those are our 5 concepts associated with functional taping for musculoskeletal injuries. With any luck, we'll see you at a class sometime soon.